Hello and welcome. My name is Donna Zubrod. Some of you may know me. I'm a fertility educator at Reply OBGYN. I'm also a nationally certified and North Carolina licensed therapeutic massage practitioner, certified birth doula, and spinning babies aware practitioner. I've been working with pregnant couples in the Triangle area for the past 11 years. My practice and my ongoing skill development focuses on helping pregnant people to understand why they are experiencing discomforts during pregnancy, how to manage this when it occurs, and as well, I help them physically prepare for childbirth. In educating these couples, I also teach self-care practices for them to continue at home. So at Reply, we often get questions about, why am I experiencing this pain and discomfort? So today I'm going to explain why this discomfort is common during pregnancy. And I'm also going to demonstrate some things that you can do, because often we get questions about, oh, what is it can I do? And you can do these self-care practices alone and also as a couple to help manage the discomfort and help bring about more balance in your pregnant body. So today we're going to talk about why you're experiencing discomfort and some things that you can do. I think it's really important to mention right up front that at any time, if you're experiencing any sort of pain and discomfort, it is always wise to check in with your care provider first. So that's an important thing to remember. And if they say that this is common or that it's a normal thing to experience during pregnancy, then these are the actions that you can take. So how common is pain during pregnancy to begin with? Just so the research studies show that, and they have a variety of names, pregnancy-related lumbar pain, pelvic girdle pain, sciatica, you may have heard some of these, symphysis pubic dysfunction, and each of these have a frequency rate of about 50%, and in many cases it's a combination of the above. So you could say that many, if not most people, do experience some discomfort and pain during pregnancy. And what I wanted to mention to you today is that pain during pregnancy is common, but it isn't normal, and normal with quotes, and there are things you can do to help manage what you're experiencing. So why is discomfort in pregnancy during pregnancy so common? And this can be really helped by looking at what is actually happening with a growing baby. And I have an image. So when you're comparing the two images here, look how the image on the left, the head is leaning forward. You can see a lot of stress is happening in the neck and the upper back. How the breasts are kind of lower and your shoulders rolling forward. So when we're looking at things that we can do to help this, we're trying to relax the muscles so that the body that you see on the left begins to look more like the body on the right with this balance. And we can do those things. Understand though, that belly is with you for a long time, and just doing an exercise or a stretch once isn't going to fix the problem. It's just a way of managing it over a period of time. So the things that I'm going to show you next are things that you need to be doing on a daily basis to help manage the pain and discomfort. So you remember from the pictures that I just showed you that one of the areas where there's some tension and discomfort can be up in the jaw and in the neck and upper shoulders. So I'm going to show you a variety of things that you can do. First, we're going to start with is the jaw release. I'm going to demonstrate it on myself using my hands, the pads of my fingers, finding the cheekbone, coming along the edge of the cheekbone to just in front of my ears. I'll turn my face so you can see where I am. You can see that my finger pads are flat on my face. And I'm going to clench for a moment. And I'm going to see something pop up underneath my fingers, and that's the masseter muscle. So what you're going to do here now is you're going to press directly in like your fingers are meeting in the middle of your head. You're going to do that for about 15 seconds. You might feel it softening underneath your hands, your fingers. And then you're going to maintain the pressure, but you're going to change the direction of the pressure so that you're stretching the tissue over the bone downwards. And do that for 15 seconds. And then you're going to be at a new place and you're going to press in for 15 seconds. I'm not going to take all the 15 seconds. I'm going to show you how this would do. And then you're going to press down. And eventually you do this, and eventually you're going to come all the way down here. And you're going to go, oh, wow, that feels really good. Feels much more relaxed. And you'll notice your whole jaw will just kind of like sink down. Another thing that you can do are shoulder circles. And this, you notice when I showed you a picture that the pregnancy compensation patterns tends to get the shoulders to roll forward. So here, we want to get the shoulders back and down. So first you take it up to your ears, back, and then down. And up, back, and down. Up, back, and down. So often I'll get asked, well, how many times should I do this? Well, as many times as you can never do too much, as long as it feels good and what you have time to do. These other ones, I'm going to need a partner to help with the other shoulders. So I'm going to ask my pregnant husband to come and sit here for a moment in the chair so I can demonstrate some of these for you. So, pregnant husband, will you come speak for a moment, please? Okay. So, to help relax the shoulders, person is sitting in front of you. Bring your arms, rest the arms on the soft part here, not on the hard part with the shoulders, and just sink with your body weight. Invite your pregnant partner to take a nice deep breath. Nice job. And hold this for about 30 seconds. And all I'm doing is just resting. Okay. After that's been done, that helps to soften the muscles. You can come in with some nice, all I'm doing is like this with my hands, bringing the flats of my fingers to my palms and compressing, just like that. And then you can also bring these down the upper arm. You just don't, you never press on bone. There's tissue. So you can start coming down the muscles. So on me, if I wanted to do this on myself, this is what I'd be doing. Okay. So now we're going to look at some things that you can do to help get more room so that you feel like you can take deeper breaths, to help relax your lower rib cage, and also to help do some nice massage to your belly. Let's take these things one at a time. So to help with the ribs, you're going to place your hands, the entire hand, the index fingers just right along the edge, bottom edge of your rib cage. The hands are flat. You can take a deep breath in, and as you take that breath in, you're going to sink. Sink in and then exhale and let go. Place hands, deep breath in, sink in, breathe out, let go. Place hands, deep breath in, sink in, breathe out, let go. And if you stop and you just take a moment, you'll probably notice you can take a deep breath. With all these exercises, it's kind of fun to take a deep breath first, then do the exercises, and then take a deep breath again, and then you can really see the benefits of what you've done. We have an image here Your entire uterus is being supported by almost like a balloon thing called the broad ligament, and there's also a round ligament at the front and a uterosacral ligament at the back. And it's good to get nice blood flow. And so massaging your belly right at the surface very gently with fully relaxed hands is helping to get some nice blood flow to your belly. And it feels good for you and it feels good for the baby. The way we do that is circular strokes, completely relaxed hand. Every part of my hand right now is touching my belly, from the wrist all the way to the fingers and the palms. Very gently, clockwise circles. Really helps you connect with the baby within, and it just feels really nice. Maybe you do this for 30 times. And also, to help, you notice from the picture that I show that the belly was leaning forward and it was very heavy at the front. Again, with completely flat hands, just lift. Lift. You can do this right now as I'm doing it over my clothing. You can also do it on bare skin with an oil of your choice. So now we're going to move to things that you can do to help with the lower body and your hips and your glutes that are working so hard. They're working so hard. They're tightening so much because those tight muscles are holding you upright with all that extra weight at the front of your body so that you don't fall forward on your face. So they're doing an awful lot of work. So here's some ways that you can give them some tender loving care and get them to relax. One is a seated figure 4 stretch. And this is such a great thing because you can do it many times sitting on the edge of a chair so that you feel your sits bones on the edge of the chair, and you bring your one ankle to a knee and you just relax in there for about 30 seconds, and then you'll change and you'll do the other one for about 30 seconds. And finally, another one is to really open up those glutes and the hips is a deep squat, which is opening up that part of your low back. And that you can do by yourself, by leaning on the kitchen counter and going into a deep squat and imagining that you're trying to get your butt pushed onto the wall behind you. You can find a variety of things to hang from, make sure that they're secure to begin with. And you can also use your partner in this. This is a fun one to do with that. So all of these can be helpful, make it part of your routine during the day. My clients tell me that they find them very, very useful, and it helps them to connect with their body and with the baby within and with their partner. They're fun to do. So I hope I've explained to you why it is that you're experiencing discomfort in your body and some exercises and stretches that you can do to help with some of the discomfort. I'll remind you again that if the pain and discomfort does continue, to please get in touch with your care provider. And please tune in again next week, as I'm going to be offering more self-care suggestions to help keep you comfortable and balanced during your pregnancy. If you're a patient at Reply and have any questions, please contact us at 919-230-2100 or contact us via our patient portal or Reply Health app. And if you'd like to get in touch with me directly, you can reach me at dzubrod@replyobgyn.com, and I'd be absolutely happy to answer any questions that you may have. Thank you for tuning in. Have a good day.